Welcome to my father's show, Cold Laser
TV.
Hi, my name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and I'd like to welcome you to this episode of Cold Laser TV. Today we're going to talk about using cold laser therapy in conjunction with ice or cryotherapy and how to best do that. Now, I will say that for many years, and I've been a chiropractor for 19 years, I will say that for many years I've been telling my patients anytime they have an acute injury, my motto has always been, when in doubt, use ice. Even before you call me, use ice. Now, since I've added cold laser therapy to my treatment regimens 7 years ago, I have modified that, and I still say when in doubt use ice, but then we also want to do cold laser therapy as soon as possible. And of course, a lot of times it is as advantageous to do adjustments, chiropractic adjustments, as soon as possible as well. So for example, if someone had a sprained ankle. So for many years, we've had a formula that we've gone by that is called RICE. RICE is an acronym for rest, ice, compression, and elevation. RICE. So what RICE means is rest. First of all, if a person, let's say, sprains an ankle, we want to have that person rest, meaning don't be on your foot bearing weight or on your ankle for hours and hours at a time if you don't need to be. It would be best if you got some rest, if you rested that ankle. Second is I for ice. So ice, we want to use an ice pack. We only want to use that for about 15 minutes on an extremity. Now, typically what I'll tell my patients is to use the ice at least 3 times a day. We can use it up to once an hour, but at least 3 times a day. But we don't want to use it more than 15 minutes at a time. So we're going to ice, for example, in this case, the sprained ankle, let's say. And the third thing is compression. C is for compression. So C, we want to put a ACE bandage or some kind of wrap around the area. Rest, ice, compression. Then elevation, we want to get that ankle or knee above the level of the heart. So if we're lying down, we just prop it up somehow. Rest, ice, compression, elevation was a formula that for many, many years, since I was in chiropractic college 20, 21, 22 years ago, that we've gone by with acute injuries. But recently, I attended a seminar where the 2 speakers were challenging that RICE formula. And what they said is that there were 11 different studies done in the recent past with over 800 participants in these studies, and they concluded that while RICE was good, it really wasn't the optimum approach. It wasn't really the optimum approach. So, of course, this was a seminar about cold laser therapy and advances in cold laser therapy. And what they recommended was that RICE plus laser is better than just RICE. So obviously RICE is okay, but we definitely want to add cold laser therapy. Well, of course, like I said earlier, kind of like I've been telling my patients for the last 7 years, since I've been aware of and have been using and have seen the wonderful results associated with cold laser therapy. But then they went on to say that even better than RICE plus laser is a new formula called MELT. M-E-L-T, MELT. So M stands for mobilization. Mobilization is a fancy word for chiropractic adjustment or an osteopathic manipulation. So that would be our M. So for example, I am the sideline chiropractor for a semi-pro football team, the Springfield Foxes. If one of my guys gets injured on the sideline, let's say sprains his ankle, then the first thing I'm really going to want to do is examine that ankle, make sure nothing's broke, obviously, first, if that's the case. But if I determine nothing's broke, then one of the first things we want to do is check the joints in the foot, heel, ankle, and get those adjusted with chiropractic care. So that's our M in MELT. E is elevate. So the second thing we're going to do, we're going to elevate. So like I said, if just like the RICE formula, if you're at home, you're going to prop it up with some pillows. In the case of the sprained ankle, we're going to actually use like a bolster or a little step stool. We're going to put that on the chiropractic table. We'll have the patient laying on his or her back. The leg is elevated up so that the ankle is higher up than the heart level. And so we're going to do the E for elevate. L then is laser. We're going to use cold laser therapy. Now, a lot of times what we'll even do now is we'll use the E and the L in conjunction with one another at the same time. So we're going to adjust or mobilize, then we're going to elevate, and once we elevate, we're going to get in there and we're going to use one of our cold laser therapy devices on that to drastically go in there and reduce that inflammation as soon as possible. And the last thing, the T in the MELT formula, stands for tape. Now for tape, we could actually use the ACE bandage like we would use in the C of the RICE formula, or some more advanced techniques would be to use athletic tape if we're actually taping an athlete and going to send them back into the game, or we could use what's called kinesio tape. And kinesio tape could be used in the office if you're a chiropractor or a physical therapist, and it could be used on the sidelines if you're a chiropractor, a sideline chiropractor, or if you're an athletic trainer. So we've got some flexibility there with the T and tape. So bottom line, folks, is if you have an acute injury, we definitely always want to use ice, and we definitely want a laser as soon as possible as well. Which brings me to the final point here. And that final point is, I tell people that my acute patients, I tell them that I'd like them to ice at least 3 times a day, as I said earlier. I also tell them we're going to be doing cold laser therapy. So for many of them, that means they're going to be coming in usually about 6 to 8 visits for cold laser therapy treatments in my office. Now, some of them own their own at-home laser devices, and they will be using those on a daily basis as well, or at least on the days they're not going to see me in the office. So, if we're going to ice, how do we plan that around the laser treatment? Well, if we're going to laser, we want to ice, we can ice right before we do the laser therapy. That's actually going to give us a deeper penetration of those photons into the tissues that we want to treat, because that ice beforehand is going to drive inflammation out of the area. It's going to also drive some blood supply out of the area, so our photons are going to get deeper. Now, once we laser the patient and then we send them home or they leave the office, we also want to warn them that we want them to wait at least 3 hours after that laser treatment until they ice again. Because if we ice too soon after the laser treatment, we're going to decrease the chance of those laser light photons doing as much as they could possibly do in that area, in the deeper cells and tissues. So we definitely want to ice at least 3 times a day if it's acute, but we just want to schedule it around the cold laser therapy treatments. So we can ice immediately before or within a half hour to an hour before the laser session, and then we can ice again, but we have to wait until at least 3 hours after the cold laser therapy treatment. So that is how we use ice in conjunction with cold laser therapy. That's how we use the old RICE formula, the newer RICE plus laser formula, and the even newer MELT formula. So I hope you've got some good information about ice therapy, or cryotherapy as it's technically properly called, and cold laser therapy. And I hope you will join me in future episodes of Cold Laser TV as we talk about other topics as they pertain to that wonderful healing art known as cold laser therapy. Thank you and have a terrific day.